What if your stomach isn't just irritated, but is quietly becoming more inflamed every single day? Millions of people dismiss stomach pain, bloating, or heartburn as normal, but these symptoms can sometimes signal that stomach inflammation is getting worse. In today's video, we'll reveal the 7 warning signs you should never ignore, explain the science behind them, and discuss what you can do to help protect your digestive health. Stay until the end because the final warning sign is one that many people completely overlook. Many people experience a burning sensation in the stomach from time to time, especially after eating spicy foods, drinking too much coffee, or taking certain medications. Because these episodes are so common, it's easy to assume they are harmless. However, when that burning feeling becomes frequent, more intense, or lasts for days or weeks, it may be a sign that the lining of the stomach is inflamed. This condition, often referred to as stomach inflammation or gastritis, develops when the protective barrier that normally shields the stomach lining becomes weakened. Once this protective layer is damaged, stomach acid can irritate the tissue underneath, leading to ongoing discomfort and inflammation. The stomach naturally produces powerful acids to help break down food and destroy harmful bacteria. Under healthy conditions, a thick layer of mucus protects the stomach from these acids, but several factors can weaken this defense. Long-term use of pain-relieving medications such as non-steroidal anti-inflammatory drugs, excessive alcohol consumption, chronic stress, smoking, infections caused by Helicobacter pylori, and certain autoimmune conditions can all contribute to damage of the stomach lining. When the protective barrier is compromised, even normal amounts of stomach acid may begin to irritate the tissue, causing symptoms that gradually become more noticeable. One of the earliest warning signs is a persistent burning or gnawing pain in the upper abdomen. Some people describe it as a feeling of heat just below the breastbone, while others compare it to an ache that comes and goes throughout the day. The discomfort may appear shortly after eating, several hours later, or even when the stomach is empty. In some individuals, eating temporarily reduces the pain because food can briefly buffer stomach acid. For others, meals may make the burning sensation worse, especially if the food is spicy, acidic, fried, or high in fat. It's important to pay attention to patterns rather than isolated episodes. Nearly everyone experiences indigestion occasionally, but if stomach pain occurs several times a week, wakes you from sleep, or continues despite simple lifestyle changes, it deserves further evaluation. Persistent symptoms may indicate that the inflammation is progressing instead of healing. Many people unknowingly make the problem worse by relying on temporary solutions without addressing the underlying cause. They may frequently take over-the-counter antacids to reduce discomfort, yet continue habits that irritate the stomach lining. While these medications can provide short-term relief, they may not treat the reason the inflammation developed in the first place. Identifying and addressing the underlying cause is an important part of managing ongoing stomach symptoms. Diet also plays a significant role. Foods that are very spicy, highly processed, greasy, or acidic may trigger symptoms in some people. Beverages containing caffeine or alcohol can also increase irritation for certain individuals. However, triggers vary from person to person, so keeping a food diary can sometimes help identify patterns. Eating smaller, more frequent meals instead of large portions may also reduce discomfort for some people. Stress is another factor worth considering. While stress itself is not always the direct cause of gastritis, long-term stress can influence digestion, alter stomach function, and contribute to behaviors that increase stomach irritation, such as poor eating habits, smoking, or increased alcohol consumption. Managing stress through regular exercise, adequate sleep, relaxation techniques, or mindfulness may support overall digestive health, although it is not a substitute for medical treatment when needed. Ignoring persistent stomach pain can allow inflammation to continue unchecked. Over time, ongoing irritation may increase the risk of complications, including stomach ulcers or bleeding in some cases. This is why persistent or worsening pain should not simply be dismissed as normal acidity. Another warning sign that stomach inflammation may be worsening is frequent nausea, vomiting, and a noticeable loss of appetite. Occasional nausea can happen after eating spoiled food or during a viral illness. But when it becomes a recurring problem, it may reflect ongoing irritation of the stomach lining. Inflammation can interfere with the stomach's normal ability to process food. As the stomach becomes irritated, its normal contractions may become less efficient, making digestion feel uncomfortable. This can create a lingering sensation of nausea, particularly after meals. Some people feel sick after only a few bites of food, while others notice that even the smell of certain foods makes them feel unwell. As inflammation progresses, appetite often decreases. This is partly because eating becomes associated with discomfort. If every meal is followed by burning pain, bloating, or nausea, it's natural to start eating less. Over time, reduced food intake may contribute to fatigue, unintended weight loss, or nutritional deficiencies if it persists. Vomiting is another symptom that should be taken seriously, especially if it happens repeatedly. While occasional vomiting can occur for many reasons, repeated episodes may indicate significant irritation of the stomach. In rare cases, vomiting that contains blood or material resembling coffee grounds can be a sign of bleeding in the upper digestive tract. This requires immediate medical attention. Nausea and poor appetite are not unique to stomach inflammation and can occur with many different medical conditions. That is why persistent symptoms should be evaluated by a qualified healthcare professional rather than self-diagnosed. A clinician may recommend tests such as blood work, testing for Helicobacter pylori, or, in some cases, an upper endoscopy to examine the stomach lining directly and determine the underlying cause. Early evaluation is especially important if nausea is accompanied by severe abdominal pain, difficulty swallowing, unexplained weight loss, persistent vomiting, black stools, or vomiting blood. These symptoms may indicate a more serious condition and should not be ignored. Recognizing persistent burning pain, recurring nausea, vomiting, and loss of appetite as potential warning signs can encourage earlier medical evaluation and appropriate treatment. Addressing stomach inflammation before it becomes more severe may reduce the risk of complications and improve overall digestive health. Bloating and indigestion are often dismissed as minor digestive problems, especially after eating a large meal. Many people assume that feeling overly full, having excessive gas, or experiencing discomfort after eating is simply a normal part of life. However, when these symptoms occur frequently or become more severe over time, they may be signs that stomach inflammation is getting worse. Chronic inflammation of the stomach lining can interfere with the normal digestive process, making it more difficult for the stomach to break down food efficiently and move it into the small intestine. The stomach is designed to store food temporarily while mixing it with digestive acids and enzymes. Powerful muscular contractions help grind food into smaller particles before it passes into the intestines. When the stomach lining becomes inflamed, this process may not work as smoothly. Inflammation can affect how the stomach contracts, sometimes causing food to remain in the stomach longer than normal. This delayed emptying can leave a person feeling unusually full even after eating only a small amount of food. One of the most common complaints is early fullness. Instead of finishing a regular-sized meal, a person may feel satisfied or even uncomfortable after just a few bites. This sensation may seem harmless at first, but if it happens repeatedly, it could indicate that the stomach is not functioning normally. Some people begin skipping meals because eating becomes uncomfortable, while others unintentionally reduce their calorie intake, which may contribute to gradual weight loss over time. Bloating is another symptom that often accompanies stomach inflammation. People frequently describe their stomach as feeling swollen, tight, or stretched. Clothing may feel tighter around the waist, even though there has been no significant weight gain. This uncomfortable pressure can develop shortly after meals and may last for several hours. In some cases, bloating is accompanied by frequent belching as trapped air escapes from the stomach. Indigestion, also known as dyspepsia, includes several symptoms that often occur together. These may include burning discomfort, upper abdominal pain, bloating, frequent burping, nausea, and a general feeling that digestion is slow or incomplete. While occasional indigestion is common, persistent symptoms may suggest ongoing irritation of the stomach lining rather than a temporary digestive upset. Several factors can make bloating and indigestion worse. Large meals place greater demands on the digestive system, especially when the stomach lining is already inflamed. Foods that are greasy, fried, spicy, or highly processed may trigger symptoms in some individuals. Carbonated beverages can increase gas, while excessive caffeine or alcohol may further irritate the stomach lining. Eating too quickly may also contribute by causing people to swallow more air and overfill the stomach before the body has time to signal fullness. Certain infections, particularly Helicobacter pylori, can also contribute to chronic inflammation and digestive symptoms. This bacterium can weaken the stomach's protective lining, allowing acid to irritate the tissue more easily. Not everyone with H. pylori develops symptoms, but when symptoms do occur, they often include persistent indigestion, bloating, nausea, and upper abdominal discomfort. Healthcare professionals can perform specific tests to determine whether this infection is present and recommend appropriate treatment if necessary. Lifestyle habits also influence digestive health. Smoking may reduce the stomach's ability to protect and repair its lining. Heavy alcohol use can directly irritate stomach tissue, while chronic stress may worsen digestive symptoms in some individuals. Although stress alone is not usually the direct cause of gastritis, it can affect digestion and may make symptoms feel more noticeable. If bloating, indigestion, or early fullness continue for weeks despite lifestyle adjustments, medical evaluation is important. Persistent symptoms should not simply be accepted as part of getting older or blamed entirely on diet. A healthcare provider may recommend testing to identify the underlying cause and determine whether stomach inflammation, ulcers, infection, or another digestive condition is responsible. Another warning sign that should never be ignored is the presence of blood in vomit or black, tarry stools. Unlike bloating or indigestion, which may have many possible explanations, these symptoms can indicate bleeding somewhere in the upper digestive tract and require immediate medical attention. The stomach lining contains many tiny blood vessels. When inflammation becomes severe, ongoing irritation can damage the surface of the stomach enough to create small erosions or ulcers. As these injuries deepen, nearby blood vessels may begin to bleed. Sometimes the bleeding is slow and difficult to notice at first, while in other cases it can occur suddenly and become a medical emergency. Blood in vomit can appear bright red if the bleeding is active and rapid. However, it may also look dark brown or resemble coffee grounds. This darker appearance occurs because stomach acid has partially digested the blood before it is vomited. Either appearance should be treated as an urgent warning sign rather than something to monitor at home. Black, sticky, tarry stools are another important symptom. As blood travels through the digestive tract, digestive enzymes and bacteria change its color, producing stools that are black and have a distinctive tar-like appearance. This condition, known medically as melena, often indicates bleeding from the stomach or the upper part of the small intestine. It is different from ordinary dark stools caused by certain foods or medications such as iron supplements or bismuth-containing products, although a healthcare professional may need to determine the exact cause. Internal bleeding may also produce symptoms that are less obvious. A person may begin feeling unusually weak, dizzy, or lightheaded because of blood loss. They may notice increasing fatigue, pale skin, or shortness of breath during routine activities. If bleeding continues over time, iron deficiency anemia can develop, reducing the body's ability to carry oxygen efficiently. Several factors increase the risk of stomach bleeding. Long-term use of non-steroidal anti-inflammatory drugs, such as ibuprofen or naproxen, can damage the stomach's protective lining. Excessive alcohol use, untreated Helicobacter pylori infection, severe stomach ulcers, and certain prescription medications that affect blood clotting may also increase the likelihood of bleeding. Anyone who experiences vomiting blood, black tarry stools, severe dizziness, fainting, rapid heartbeat, or signs of significant blood loss should seek emergency medical care immediately. These symptoms should never be ignored or treated solely with home remedies because prompt evaluation can be critical. Healthcare professionals may perform blood tests, imaging studies, or an upper endoscopy to identify the source of the bleeding and provide appropriate treatment. Recognizing these warning signs early can make a significant difference. While many digestive complaints are mild and temporary, persistent bloating, chronic indigestion, early fullness, vomiting blood, or black tarry stools are symptoms that deserve careful medical evaluation. Early diagnosis and appropriate treatment may help prevent complications, reduce ongoing inflammation, and support long-term digestive health. Unexplained weight loss and persistent fatigue may not seem directly related to stomach inflammation at first, but they can be important warning signs that the condition is becoming more serious. Many people assume that losing a few pounds is simply the result of eating less or being more active. However, when weight loss happens without intentionally changing your diet or exercise routine, especially when it is accompanied by digestive symptoms, it deserves careful attention. The stomach plays a critical role in the digestive process. It not only stores and breaks down food, but also helps prepare nutrients for absorption later in the intestines. When the stomach lining becomes chronically inflamed, this process may not work as efficiently. Ongoing irritation can make eating uncomfortable, reduce appetite, and interfere with normal digestion. Over time, a person may begin consuming fewer calories simply because eating causes pain, nausea, or bloating. This gradual reduction in food intake can eventually lead to noticeable weight loss. Unlike intentional weight loss achieved through healthy lifestyle changes, unexplained weight loss often occurs without planning or effort. Clothes may become looser, energy levels may decline, and family members may notice physical changes before the individual realizes what is happening. Loss of appetite is one of the main reasons people with worsening stomach inflammation may lose weight. When every meal is followed by discomfort, burning, or nausea, eating becomes less enjoyable. Some individuals begin skipping meals, while others eat much smaller portions than usual. Although this may temporarily reduce digestive discomfort, it also limits the body's supply of essential nutrients. Fatigue is another symptom that frequently accompanies chronic stomach inflammation. Many people describe feeling tired even after getting enough sleep. Everyday tasks that once seemed easy may become more difficult, and concentration at work or school may suffer. Persistent fatigue can develop for several reasons. One possible reason is inadequate calorie intake. The body depends on food to produce energy. When appetite decreases and nutritional intake falls, energy production also declines. Another contributing factor may be nutritional deficiencies that develop over time. Chronic stomach inflammation can sometimes affect the body's ability to absorb certain nutrients properly. For example, long-term gastritis may reduce the absorption of vitamin B12 in some individuals, particularly when the inflammation affects the cells responsible for producing intrinsic factor, a substance needed for vitamin B12 absorption. Vitamin B12 plays an important role in nerve function and red blood cell production. Low levels may contribute to fatigue, weakness, numbness, or tingling in the hands and feet, memory difficulties, and anemia. Iron deficiency can also develop if chronic stomach inflammation leads to slow, unnoticed bleeding or reduced dietary intake. Iron is necessary for producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. When iron levels become too low, oxygen delivery decreases, leading to tiredness, weakness, shortness of breath, and reduced exercise tolerance. Not everyone with stomach inflammation develops nutritional deficiencies, but persistent fatigue combined with digestive symptoms should not be ignored. Healthcare professionals may recommend blood tests to evaluate vitamin levels, iron stores, and other indicators of nutritional health if symptoms suggest a deficiency. Unexplained weight loss can also occur in other digestive conditions, including stomach ulcers, inflammatory bowel diseases, thyroid disorders, certain infections, and even some cancers. This is why persistent weight loss should always be evaluated by a healthcare professional rather than assuming stomach inflammation is the only cause. Identifying the correct diagnosis is essential for receiving appropriate treatment. Another important warning sign is fatigue that continues even after stomach symptoms appear to improve. While occasional tiredness is common, persistent exhaustion lasting several weeks deserves medical attention, especially if it is associated with dizziness, pale skin, rapid heartbeat, or shortness of breath. These symptoms may indicate anemia or another underlying medical condition that requires evaluation. The good news is that treating the underlying cause of stomach inflammation often helps improve both appetite and energy levels. Addressing infections such as Helicobacter pylori, avoiding medications that irritate the stomach when medically appropriate, making dietary adjustments, and following treatment recommended by a healthcare professional may allow the stomach lining to heal over time. As digestion improves, appetite often returns gradually, making it easier to restore proper nutrition and maintain a healthy body weight. Knowing what to do before stomach inflammation becomes more severe is equally important. Many people wait until symptoms become unbearable before seeking medical advice, but early action may help reduce the risk of complications. Recognizing persistent digestive symptoms and responding promptly gives healthcare professionals the opportunity to identify the underlying cause and begin appropriate treatment before more serious problems develop. One of the first steps is identifying potential triggers. Certain foods may worsen symptoms in some people, although triggers vary between individuals. Spicy foods, fried meals, highly processed foods, acidic foods, excessive caffeine, and alcohol may increase stomach irritation for some individuals. Keeping a food diary can help identify patterns between meals and symptoms, making it easier to discuss these observations with a healthcare provider. Eating habits also matter. Large meals may stretch the stomach and increase discomfort, whereas smaller, more frequent meals are sometimes easier to tolerate. Eating slowly and chewing food thoroughly may also improve digestion by reducing the workload placed on the stomach. Hydration is another important part of digestive health. Drinking enough water throughout the day supports normal body function, although some people find it more comfortable to avoid drinking large amounts of liquid during meals if it worsens bloating. Individual responses vary, so adjustments should be based on personal tolerance and professional medical advice. Avoiding tobacco products is another positive step. Smoking has been associated with delayed healing of the stomach lining and may increase the risk of ulcers. Limiting or avoiding alcohol may also reduce irritation and allow the stomach more opportunity to recover. Medication use deserves careful attention as well. Non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen can contribute to stomach irritation, particularly when used frequently or for long periods. People should never stop prescribed medications without consulting their healthcare provider, but discussing safer alternatives may be appropriate if these medicines are contributing to digestive symptoms. Managing stress can also support overall digestive health. While stress alone does not necessarily cause gastritis, chronic stress may worsen digestive discomfort in some people. Regular physical activity, adequate sleep, relaxation techniques, and maintaining a balanced daily routine may help improve overall well-being and reduce the impact of stress on digestion. Perhaps the most important step is knowing when professional medical evaluation is necessary. Persistent stomach pain lasting more than a few weeks, recurring nausea or vomiting, unexplained weight loss, difficulty swallowing, vomiting blood, black tarry stools, severe abdominal pain, persistent fatigue, or symptoms that continue despite home care all warrant medical attention. Healthcare professionals may recommend tests such as blood work, Helicobacter pylori testing, stool testing, or an upper endoscopy to determine the exact cause of symptoms. Early diagnosis allows treatment to begin before complications such as ulcers, bleeding, or significant nutritional deficiencies develop. Although many cases of stomach inflammation improve with appropriate medical care and lifestyle adjustments, delaying evaluation may increase the risk of more serious health problems. Paying attention to warning signs, making healthy lifestyle choices, and seeking timely medical advice are important steps toward protecting long-term digestive health.